The thalamus sends those impulses up to the motor cortex. And then the motor cortex sends them down the spinal cord, and eventually you look at the muscles. This here, from here going down through the spinal cord net, that's the pyramidal motor system. From the motor cortex down the spinal cord to the muscles, that's the pyramidal motor system. So what we say is the extrapyramidal motor system fine-tunes the pyramidal motor system. Right? The extrapyramidal motor system fine-tunes the pyramidal motor system. What do you think has more dopamine in this area, men or women?
Serotonin, woman.
Think of handwriting. Very good. Very fine. Okay. All right. Now this page, going back, is more of a summary page. And it's what you need to know for the test. The bottom line. And try to remember some definitions. Okay? It says, normally, cholinergic activity in the striatum. The striatum is the caudate nucleus plus the putamen. Everybody calls it the striatum. That's why it's called the nigral striatal system. Is modulated by inhibitory influence from dopaminergic neurons of the nigrostriatal tracts. I showed you that before. Dopamine inhibits acetylcholine, right? Remember that little picture? Maybe I should rip it out and show you. There it is, dopamine inhibiting acetylcholine. We already talked about that. In Parkinson's disease, degeneration of the dopaminergic neurons of the substantia nigra. By the way, it's called the substantia nigra pars compacta. We're just going to call it the substantia nigra. You don't have to get really into the subdivisions. Okay? Has been observed leading to a functional deficit of inhibitory influence on cholinergic activity in the striatum. Both D1 and D2 receptors, type or receptors, are involved. The D1 receptor excites the excitatory pathways. It's like putting on the gas. Okay? The D2 receptors inhibit the inhibitory pathways. It's like taking off the brakes. In other words, you're causing disinhibition of the brakes. Okay? All right? It turns out then that maximal efficacy is going to be when you stimulate both the D1 and the D2 receptor simultaneously. That'll give you maximal activity. All right. The severity of dope disorder is related to the extent of nigrostriatal degeneration. In humans, the loss of dopamine-containing neurons in the substantia nigra occurs at a rate of approximately 3 to 15% per decade of life. If you're on the 15% per decade of life, you're in trouble. If you're on the 3%, you're not going to have a problem. Okay? However, there's 80%. You have to lose more than 80% before the symptoms first show up. So you can lose a lot and still not have Parkinson's disease. Okay? The increasing dopamine content of the striatum is roughly proportional to the depigmentation in the substantia nigra. That's why you saw in that picture that in the Parkinson person, you didn't see any pigmentation in the brain. The more neurons are destroyed, the more you're going to be depigmentated because the melanin is made inside the neurons from L-dopa. The same thing that makes dopamine also makes the melanin. Okay, then they tell you if you have skin melanin. Wait a minute. Oh, since L-dopa is also a precursor of skin melanin, L-dopa therapy is contraindicated in patients with a history of malignant melanoma. That's obvious. Okay, we then need to talk about dopamine receptors. Right now, there's 5 major receptor types, and they're called D2-like and D1-like. The D2-like, or the D2 receptor itself, D3 and D4. The D1-like, or D1 and D5. Okay, I can tell you what the D2-like ones do. They decrease cyclic AMP. They increase potassium channel opening. What's that going to do? Hyperpolarize. Okay, and they also decrease calcium influx into neurons. What's that going to do? Prevent release of neurotransmitter. Okay, the big one for D1s is D1s increase cyclic AMP. They also increase the PIP2 system. Now, the autoreceptors on dopamine neurons and terminals are D2-like. Mainly it's the D2 itself. The autoreceptors on D2 neurons, the autoreceptors on dopamine neurons, both the terminal and the soma, are D2. And you can understand what they do is they open the potassium channels and hyperpolarize the neuron in the terminal. And they inhibit the calcium influx, so you don't release neurotransmitter. Okay. I love this little picture here. From now on, whenever we talk about this system, whether we're talking about antipsychotics or any other point during this term, if you just think about the balance, you'll understand everything. If you just understand the balance, you'll pretty much understand this system from now on. Okay? What happens, do you think, if you get too much dopamine in the system? You get what we call the dyskinesias. That's when involuntary movements, you start to get, remember the skills and the fine-tuning is stored in the basal ganglia. If you get too much dopamine, what you do is you get the dyskinesias, you start to get involuntary movements. Okay? Because remember, the basal ganglia provides the involuntary part of voluntary movements. It's the involuntary component of voluntary movements, the automatisms, things you do automatically. Okay, one thing I forgot to mention. As you are treating the disorder, disease marches on. The destruction of those neurons continues. You are just treating basically the symptoms. Okay? You're not preventing any destruction of those neurons. So the disease marches on even as you are treating. Okay? Okay. This thing shows where the substantia nigra is. It's considered in the midbrain. It's at the top of the brainstem, basically. Okay? It's considered the midbrain. They show you where the basal ganglia are up there. Don't worry about that too much. What you do have to know then is the synthesis of dopamine. Okay. It all comes from tyrosine, which is an amino acid. Okay? Now, tyrosine, the rate limiting step in the formation of dopamine is tyrosine hydroxylase. And when you get the tyrosine hydroxylase, you end up with, it says here, dopa, it's L-dopa. Because this is the L amino acid, you end up with what we call L-dopa. Okay. Now, to make dopamine, then you have to decarboxylate, okay, dopa to make dopamine. And what I want you to put next to that is that dopa decarboxylase, vitamin B6 is a cofactor. And now, okay, one other thing. Dopa decarboxylase is the name we give to the enzyme when we're talking about dopa. But actually that decarboxylase is a generic decarboxylase called aromatic amino acid decarboxylase. So dopa decarboxylase is the name we give it. But it's really a generic enzyme called aromatic amino acid decarboxylase. Why? Is this an aromatic amino acid? You're going to decarboxylate it. Okay? So this is sometimes called AAAD. It's the same thing as dopa decarboxylase. Aromatic amino acid decarboxylase. We call it dopa decarboxylase because it's more descriptive, but it gets a lot of other aromatic amino acids. Okay? Serotonin is an aromatic, tryptophan is an aromatic amino acid. Okay? Histidine is an aromatic amino acid. Phenylalanine is an aromatic amino acid. So it could decarboxylate any of those things. All right. Interesting thing is where this thing is found. It's found in the gut, the stomach, and the intestine. We'll call that the gut. It's found in the liver. And it's found, within the dopamine neurons of the brain. Actually, I don't know if it's outside of the neurons or inside of the body. Well, it's up in the brain, too. That's going to be important later on. Okay. The way you metabolize dopamine is, dopamine, and you can go in either order. You can methylate the hydroxy group in the 3 position, and the enzyme that does that is COMT, catecholamine oxygen methyltransferase. And then NaO, will deaminate it. No matter what, you end up with what they call HBA. That's the final metabolite. Now, I want to talk about monoamine oxidase for a second. There are 2 major forms of monoamine oxidase. Monoamine oxidase A metabolizes serotonin, norepinephrine, and dopamine. Monoamine oxidase B, is mainly, dopamine only. So in other words, dopamine can be metabolized by monoamine oxidase A or B. Here's the deal. In the liver, you have monoamine oxidase A. In the brain, you have both of them. Monoamine oxidase A and monoamine oxidase B. All right, that's just a preview. So we're going to talk about our first agent. L-DOPA is recognized. Excuse me?
I have a question. When you were talking about the AAAD, is that what you were saying was located in the gut and the stomach?
It's in the gut, it's in the stomach, intestine, and in the liver.
Thank you.
And obviously in the brain, too. It's obviously in the brain. Because you have to make the dopamine in the brain, too. So I should have added that. I did? Oh, okay. Okay. L-DOPA is a prodrug. It's a prodrug of dopamine. Now, the reason we can't give dopamine is it doesn't cross the blood-brain barrier by itself. L-DOPA, on the other hand, has a carrier, a transport molecule. And that transport molecule is found both in the intestine and in the